So my family moved here from Houston, Texas, and my husband grew up in Lancaster, and I grew up overseas as a missionary kid. So we were looking for something a little cooler. We wanted to see the Four Seasons, and so my husband also has a lot of family here. I have 2 kids, and they have 4 cousins that are about their age here, so we just wanted to be closer to family. I've been enjoying hiking. It's a little hot right now, but hiking, there's lakes here, there's berry picking. My kids and I love to go and eat as many raspberries as we can, so that's fun. I actually do enjoy swing dancing, country dancing. My husband and I like to go dancing a lot, so my kids love to dance. So like I am very calm during surgery, but I can be a very fun person. So I actually asked my family which offices they had heard about, and everyone in this community knew about Verber Dental, and it had a good name. They were looking for a dentist, so I figured that would be one of my best options to apply. In Houston, we don't have expanded function dental assistants, so they're allowed to do a lot more here, which means that I have a little more time to do what I want and what I want to focus on. I also have more time to talk with patients. My favorite part about dentistry is making people smile. So if I can fix their front teeth to a point where they feel like they can smile and be happy and comfortable with that. Also, if they have other teeth problems that are causing daily pain or discomfort or problems, I love being able to fix that, just improving people's lives. That's why I got into dentistry. So far, I love it. Everyone here is so skilled. They know what they're doing. They've had extensive training in what they are doing, and so I feel like I jumped right into a team and we work so well together. I'm very responsive to the patient's needs. So if they tell me I'm feeling something, I'm gonna stop, I'm gonna add numbing, check whatever the problem is. If they tell me they're uncomfortable, I'm gonna adjust the chair or whatever needs to be done. And if they have any other concerns that they wanna express to me, I try to be very open to that, and I wanna listen to whatever issues they have. I know sometimes dentists can get a little hyper-focused, but I really prioritize what the patient is feeling and needing at that time. The great thing about being a general dentist is I can do a lot of different things. So currently I'm trying to do more root canals, which I really do enjoy. I especially enjoy it because it is one of those procedures where if a patient comes to you in pain, you can get them out of pain that same day. And it's also very detail-oriented, which I also love, which is why I started in dentistry. So with the EFTAs doing more of the fillings and all of that, I can do things like root canals, I can do more crowns, I can do things like veneers if a person has a problem with their smile, Invisalign, again, if their teeth aren't exactly how they want them to be. So I can focus on things like that. Also, actually a couple of days ago, I did have a patient who had a filling that was really stained on the front, and she didn't even really noticed that it was bothering her until we fixed it, and then she was like, oh wow, that looks really nice. There was one time in Houston where I actually removed a tooth for a patient, and she was very nervous, very anxious, because who wants to have a tooth removed, right? But the procedure went well, and later she made me this handmade card. She cut out the shape of a tooth and she painted it, and that was really cool. I found a good team where I can grow and learn and continue to improve as a person and as a dentist.